Okay.
Good morning, everyone. My name is Pamela Robinson. I'm a professor in the School of Urban and Regional Planning at Ryerson University. I'm also the academic lead interim for City Building Ryerson. Thank you very much for joining us today for our COVID in Perspective series. Today, we've got Professor Raktim Mitra, who is my colleague in the School of Urban and Regional Planning, speaking about mapping children's healthy movement during COVID. I'm just going to pause for a minute while everyone arrives through the Zoom, and we'll begin in about 30 seconds. Okay, everyone, let's get going. As I said, I'm Pamela Robinson, interim lead for City Building Ryerson. I'm joined today by my co-host, Stephanie Sarmiento. Stephanie is a master's in nursing student in the Ryerson Daphne Cockwell School of Nursing, and she's studying in the Leadership and Health Policy and Education stream. As a registered nurse, Stephanie's worked in a number of hospital, community, and primary care settings, and she's currently working as a public health nurse for Toronto Public Health, assisting with COVID-19 response. Stephanie, over to you, and thank you for joining us today.
Thanks for the introduction, Pamela. So I am grateful to join the Ryerson community from Toronto in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Nurses witness the outcomes of social and health inequities every day and are well positioned to advocate for equity and better outcomes. An important part of this advocacy work is recognizing our responsibility to unlearn colonial ways of thinking, challenge our racist and colonial systems, and be in solidarity with Indigenous people who continue to experience violence, oppression, and health disparities as a direct impact of colonialism. I welcome everyone to reflect on what we owe to the land and each other, and what actions we can take to uphold.
Thank you, Stephanie. So welcome to our presentation today. A few issues around mechanics, and then we'll turn it over to Professor Mitra. We'll start today with a 15-minute presentation from Dr. Mitra, and you'll have an opportunity at the end to ask questions. We're going to ask that you'll post your questions in the Q&A function at the bottom of your Zoom screen. If you find someone else's question particularly compelling or interesting, you're welcome to vote it up, which will help us start to see which questions resonate the most. All of your microphones and cameras will be muted. And so we'll do all of our question and answer work through the chat box at the bottom. This webinar is being recorded, as you know, because we all heard the Zoom voice letting you know that it was going to be recorded, and it will be shared on the City Building Ryerson website at the end of this session. So if you find it interesting, we welcome you to come back and watch again. But also, if you find it relevant, please share it with your colleagues and with your friends. Today, we're joined by Professor Dr. Raktim Mitra. He's my colleague in the School of Urban and Regional Planning, and he's also an associate professor. He's the co-director of the Transform Research Lab at Ryerson, and his research focuses on healthy movement behaviors, including walking and cycling, particularly among children and adults. He's an internationally recognized scholar in the field of children's mobility. Today, Raktim is going to share some of his most recent research. It kept him very busy this summer with colleagues that focuses on healthy movement behavior among Canadian children and youth during the pandemic and the impacts of social and built environments on their access to space and mobility. I'm going to pass it over to you, Raktim, and remind you in the audience that we think this will spark lots of questions, so we look forward to seeing them in the Q&A. Thank you. Off you go.
All right. Thank you for having me. I'm going to start sharing my screen, I guess. There. Should be the right one. So it's a pleasure to be here among you, and I have attended several of the lectures in this series, which have all been very interesting. So I'm looking forward to feedback and questions, and happy to address them. So the title of today's talk is Mapping Children's Healthy Movement During the COVID-19 Pandemic. And what I'm presenting is part of a large collaborative research that involved researchers from across Canada. And with this particular part, Meredith Gillespie, who's one of our graduate students in urban and regional planning, provided research support. So I wanted to acknowledge her before I move into the actual presentation. So the World Health Organization announced COVID-19 a pandemic on March 11th of this year. This was a significant disruption which altered the way we move, the way we work, the way we go to school, and everything, basically our everyday life. Many of us parents complain about children being hyperactive. Some of them keep complaining about children being depressed and not so active and whatsoever. Which is why we decided to do this study to look at how children's movement behavior might have changed during the pandemic. And if there is a change, then what can we learn as urban planners, people who design and build cities and communities from this experience, so that we can make our cities more healthier and more resilient in future. So that was the main motivation behind this study. So the first question that we need to ask is that, well, why do we need to study pandemic time movement behavior at all? And for that, we need to start by defining movement behaviors, healthy movement behaviors. And Public Health Agency of Canada and Canadian Society for Exercise Psychology, they define healthy movement behaviors as a combination of exercising, light activities such as walking and biking, adequate sleep, and limited time in front of a digital screen. So if we combine all these things, it provides an indication of whether a child's movement behavior can be considered healthy or not so healthy. Now, the thing is that Canadian children are not doing great. In 2019, only about 40% of Canadian children and youth met the physical activity guidelines of 60 minutes of being active every day. And when it comes to overall movement behavior, combining sleep and screen time and whatnot, even fewer children were meeting the guidelines. So the baseline conditions were not great to start with. And if these active lifestyles further deteriorate during the pandemic, that's not a good news, because physical activity and being active have short and long-term health benefits, both mental health and physical health benefits. And this is a time when children are building their habitual behavior that may transition into their adult life. So we want them to be healthy. We want children to be active, and which is why studying these movement behaviors during the pandemic is an important topic for researchers who are interested in healthy communities and so on and so forth. So with that in mind, with support from Participation, who is an advocacy organization focused on children's and adults movement and physical activity, we did a survey of Canadian parents, 1,500 Canadian parents of children and youth, and the survey was conducted in mid-April, just a month after the pandemic was declared, so at the height of all the restrictions that were in place. So as you can see from this slide, that the data is more or less representative of the Canadian population. We did not have any respondent from the Northern Territories and Newfoundland, but other than that, the distribution of the participants in our sample is representative of Canadian population in general. So this is how the data looks like. Now, in this graph, we have gray, which is basically representing no change in healthy movement behaviors during the pandemic. So in an ideal situation, we would like this gray portion to cover most of the graph, which would mean that as a result of the pandemic, children's behaviors have not really changed. But unfortunately, as you can see, that was not the case. More than half of the children and youth said that they walk and bike less, they are less physically active outside, they are playing outside less, and things like that. And on the contrary, you can see the majority of the children were spending more time in front of a digital screen and they were being indoors. So in order to understand the patterns in these healthy movement behaviors and more so in order to understand what are the contexts within which children are being more versus less active, what we did is that we ran something called a cluster analysis, which is a statistical way to group children and youth into various groups where there are similarities within children and youth a group, but they're distinct between the groups. So as a result of this statistical process, we ended up grouping all children and youth in our sample into two groups. And as you can see, that they are distinct, particularly in terms of how they are being active outside of their homes. Group one in this particular graph, which we call the children and youth with increased outdoor activities, you can see that despite the pandemic and all the restrictions, they were able to maintain their outdoor activities to some extent. On average, they're walking and biking more, they're playing outside a little bit more, and their screen time has increased, but not so much so compared to the other group. Whereas group two, which constitutes the majority of Canadian children and youth, they reported a significant decline in walking and biking, physical activity outside, and outdoor outdoor play. So clearly there is a distinct pattern in which children and youth in Canada being active or being healthy in terms of their movement behavior during the pandemic. So that gives us like an opportunity or a way to try to understand, well, what are the contexts within which some children are being more active versus other children and youth who are not so active. Now, before we go to that analysis, I wanted to show you this graph, which shows how these two different groups of children are doing in terms of meeting the physical activity guidelines. In general, as you can see, that on average, children are not active as they not as active as they used to be before the pandemic. But group one from the previous graph, who we are identified as children who are more active outdoors, there's a higher proportion of them who are meeting the physical activity guidelines and who are also meeting the 24-hour movement guidelines compared to the other group who are less active outdoors. Fewer of them are meeting these guidelines. So from a policy perspective, we want more children to be active outdoors because that increases the chance of them meeting the guidelines and being healthier both in the short and longer term. So to understand if the neighborhood context explains children's healthy movement behavior, or rather changes in healthy movement behavior during the pandemic, we ran um, a regression analysis where we looked at various characteristics of the neighborhood where each of these children live, and we measured these built environment characteristics within a kilometer of their residential location. So this summarizes the regression, which I don't want to go into detail. But if we look at the specific key findings that we're interested in, is that we found that living in apartments is a major barrier to healthy movements. All else being equal, those who lived in houses compared to apartments were significantly had a significantly higher probability of being active outdoors compared to those who are living in apartments. Also, we found that access to parks was an important factor in explaining healthy movement behaviors, particularly in high-density communities. In this graph, as you can see that there are 5 graphs. The left ones are the graphs where we are looking at the effect of access to parks when the dwelling density is very low. You can see that the graphs are sort of like stable. There's not much change as the number of parks increases. But as the dwelling density gets higher, you can see that with added number of parks, the probability of children and youth being active outdoors increases quite significantly. They're very steep curves. So there's, it seems like there are great benefits of parks and open spaces, particularly in the high density communities for children and youth being active outdoors during the pandemic times. And it's not surprising if we look at where children are spending their outdoor times during the pandemic. As you can see, this is also from the same survey, where most children, when they were outside, were spending times in their front backyards, driveways. Some were spending time on streets or parking lots and sidewalks, and a few others who were spending times in parks and trails. So in high density communities, when access to yards, driveways, etc. are limited, providing access to parks and trails and whatnot creates new opportunities for children and youth or their parents who want to be active, which is an important thing to consider. So what do we learn from this experience? As we come out of the pandemic, there is a need certainly to balance the concerns of virus transmission and at the same time being active, which is important for children's health and well-being in both short and long terms. In the short term, we feel that the public health messaging should be targeted and encourage families to become active. So that should be part of the public health messaging. But as an urban planner, my key interest was to understand what can we learn from this experience that can help us make our cities and communities more resilient to health emergencies and disruptions like that. And it seems like we have seen in previous works based on other contexts, the importance of parks and open spaces is re-emphasized based on our results, particularly in high density areas. Access to parks and open spaces can go a long way in keeping children healthy and active, and in the long term create perhaps more healthier communities. So that's it. I will be happy to address any questions. And yeah.
Thank you, Raktim, for your research. And just, I want to point out that Raktim's research collaborator, Meredith Gillespie, is also part of our attendees today. So congratulations to Meredith, too, for your significant and important contributions to this emerging work. I'm going to give the first question over to Stephanie, because I'm very interested to hear what kinds of questions Stephanie has from her public health and nursing point of view. And then we'll move over to the Q&A box. So if you've got questions, load them up, please. Over to you, Stephanie.
So I'll get things started. The first question is, the COVID-19 sociodemographic data collected in Toronto thus far demonstrates how the social determinants of health, such as housing, race, and income, are linked to the number of COVID-19 cases in various neighborhoods. So with all of these determinants of health in mind, could you speak to what short-term and long-term solutions could be created in our city to target the barriers to physical activity for children and youth during COVID and beyond?
That's a great question, Stephanie. You know, when it comes to children's activity and physical activity behaviors, pre-COVID data suggests that opportunities is an important determinant, and that's how social and social determinants of health, the socioeconomic context is so important, is that we notice that children from lower income households were less active because they had limited opportunities. Similarly, children from several particular ethnic backgrounds were less active for less opportunities as well as for other cultural reasons. So I feel, although this study does not directly look into that, but I feel like in families that are more vulnerable in terms of their sociodemographic and ethnic racial backgrounds, perhaps are even more affected by these changes in their daily lifestyles, and as a result, other health effects on their children's health, in addition to the risk of COVID virus transmission. From a public health perspective, we feel as a group of researchers that it's important for being strategic in the public health messaging as we try to come out of the pandemic and try to balance the risks and benefits of staying at home. And it's important to encourage parents, particularly parents in vulnerable conditions like low sociodemographic groups, families living in communities that are largely apartment communities, like tower neighborhoods and so on and so forth, to encourage parents to spend time with their children and be active and encourage their children to be active. So in the short term, I think this little encouragement can go a long way, because I didn't show this data, but again, in the same study, we found that in families where parents are more encouraging of their children being active, we saw much better results in terms of a positive change in healthy movement behavior. So I think that's an important one. And in the longer term, like I was presenting in my last slide, is that I feel like as we are designing communities, it's important to think about access to open spaces, access to parks and things like that, which again, have been discussed. These are not new discussions, been discussed in urban planning, urban design context for years and years and years now. But with this new health emergency, we have one more reason to consider good access to open spaces and parks in our neighborhood design principles.
Thanks, Raktim. I'm going to take the next question, and it's going to come from Donna Kohler. And Donna's a professor in our School of Early Childhood Studies here at Ryerson. Donna asks, how can we advocate for children's rights and policies that increase the number of parks in marginalized neighborhoods?
Well, the advocacy around the need for open space and parks for children is not, it's not a new thing. There are, the causes, we know the need of open spaces and parks for children. And what I'm trying to emphasize, or what our results suggests, is that these experiences during the pandemic helps us understand the importance of access to parks and open spaces even more. So what I think is that going forward, as we review how we plan our neighborhoods, and as we review what are the considerations that we are discussing as we are designing cities and communities, resiliency against public health emergencies would become an even stronger consideration in the years and decades to come. And data and evidence that we are finding based on the studies that we are doing would become an important part in the discussion, helping advocates, helping policymakers in advancing policy that ensures these very important elements in our neighborhood design. So,
okay, thanks.
So I'll take the next question. So this comes from Ibrahim, who says, "This is a great research project. I have a question about economic status of children who maintained good physical activity versus the children who did not during COVID-19. Was there any difference in their family income status, type of employment, parents' education level, or their ethnic background?"
Great question. I think it's important to remember that in this work, we are looking at changes in movement behaviors and not necessarily the absolute amount of physical activity or activity that they did, particularly because no one knew that a pandemic is coming, so there is no baseline data. So what we did is that we studied the self-reported changes in movement behaviors based on retrospective questions. In our data, we did not find a lot of effects of particularly the ethnic racial backgrounds, parents' education, and family structure. But we did notice that there were some effects in terms of income. Apparently, the middle income group, income between 70 to 150,000 people, they were doing better compared to households that were higher income or lower income compared to them. We don't know why that is the case. Another thing to explore, and this kind of connects back to Stephanie's first question, would be to see how the social and material deprivation at a neighborhood level impacted these movement behaviors, which we have not explored yet. It's still very new, and we are still trying to get a better understanding of the data and the behaviors, but that's something that we hope to look into going forward.
Thanks, Raktim. We have time for one more question. I'm going to try to combine a couple of them. So your research focused on a particular point in time, and as COVID unfolds, we're seeing variability. We're seeing variability around temporary park closures, for example, and trail access. Winter is going to introduce a new kind of disturbance. Children are now, at least in the GTA, back at school in person, if that's the option that their parents have chosen. So can you just talk a little bit about research that's going to come next and the extent to which you anticipated these kinds of variabilities for future work related to your baseline data?
Yeah, excellent question. So as we speak, we have a follow-up survey which is being collected. Again, using the same methodology, same kind of sample. It wouldn't be a panel data, so there's no way for us to go back to the same children that we asked questions, but it'll be a comparable cross-section. So over the next months, I think we'll have a better understanding of how things might have changed between April and October. And it's important for the reasons that you mentioned, is that the main thing that has changed well, there are two things that have changed between March and now. One is that we have become more used to the initial concerns have somewhat lessened. And also there's been some changes in policy. Like you said, the schools are now open. The closures are not as strict as they were in April. So it'll be a good opportunity for us to understand the impact of policy, both school policy and public policy, on healthy movement behaviors. And as we'd be able to connect this data to the rates of COVID spread among children and youth, probably it would provide us even more insights into how we should be prepared for public health policies in future, when, I hope not, but if and when we are hit with another such public health emergency.
Thank you, Raktim. With that, I have to draw us to a close. Half an hour goes by very quickly. Thank you so much to you and Meredith for sharing your research. Thank you to Stephanie for joining us today. And thanks to everyone who came and participated and asked questions. I think the range of questions and the nature of the research really speak to just how big this city building proposition is. Certainly at Ryerson, one of our preoccupations is how do we take the research we do and put it into public impact? And I think this example, along with the 3 others in our series, if you haven't caught them, which are available on the City Building Ryerson website, you can catch the work by Ann Harris and by Dr. Linda Rothman and Terry Peters, all speaking to different dimensions around city building and COVID. So thank you for joining us. We hope that you found this interesting, and we really appreciate your time today. All the best. Bye-bye. Thank you.